Welcome to episode 57 of Paper Brief, where we dive into the fascinating world of research papers. I'm Charlie, your host, and today we're joined by AI and machine learning expert Cleo, ready to dissect towards accurate differential diagnosis with large language models. Cleo, can you give us a quick teaser about today's topic?
Absolutely, Charlie. We're going to explore the crossroads of AI and healthcare, specifically how large language models, or LLMs, are changing the game in making clinical diagnoses.
That sounds groundbreaking. Could you explain how an LLM would work in a medical setting?
Sure, LLMs like the one in this study take a ton of medical data and use it to suggest a differential diagnosis, which is essentially a list of potential diagnoses based on symptoms and medical history.
So, it's like having a super smart diagnostic assistant at your side.
Exactly. It's like having a specialist that can help doctors with their clinical reasoning right there in the room, or in this case, on their computer screens.
Does that mean these LLMs could potentially outperform doctors?
Not exactly outperform. The study shows that the LLM can aid doctors significantly, especially with challenging cases where combining multiple sources of information is key.
And are there any real-world applications for this LLM just yet?
Right now, it's shown a lot of promise and could be especially useful in training and education for clinicians. It's still a developing field, but the potential is huge.
Fascinating. Any drawbacks or limitations we should be aware of?
Well, implementing AI in healthcare is complex. There are always concerns about accuracy, safety, and how these systems might change the clinician-patient relationship.
Certainly a lot to think about. It seems like technology like this could one day revolutionize healthcare.
That's the hope. But it needs careful testing, validation, and ethical consideration before it can be fully integrated.
Thank you, Cleo, for this insightful conversation. And to our listeners, thank you for tuning in to Paper Brief. We'll see you next time as we unravel more research paper gems.
Thanks for having me, Charlie, and thank you, everyone. Remember to stay curious and keep exploring.